I did enjoy and still do enjoy entertaining, and making adjustments in that regard was difficult. And also, eating out became somewhat of a challenge because you have to be very careful what you choose on a menu. Most restaurants serve a portion much larger than you really should be eating, so I've learned to leave behind what I shouldn't be having and to ask for dressings and so forth on the side so I can just dip in and have a tiny little taste. I think exercise is really paramount to feeling good, both mentally and physically. Initially, I was so tired I dropped off going to the gym. I used to go and then I dropped. And then I started going again and I found it extremely beneficial. I go generally 3 times a week, or at least I aim for 3. Generally manage 2 and a bout of shopping instead. But it is really good physically and mentally.
Pacing yourself is of the utmost importance. You already have an injury. That's your kidney disease. You don't want to worsen that situation. So taking care not to further injure yourself by straining yourself emotionally or physically is of the utmost importance. I like gardening, and I might just spend 15 minutes digging in bulbs and then take a 15-minute break.
Staying positive is a little difficult, especially when you have a chronic disease and you know that it's always going to be with you and it's not going to go away. But I think keeping positive is really important in managing the disease and just staying on top of it.
Oh, I think that keeping a positive attitude is absolutely paramount to you feeling good about yourself and feeling good about the control of your disease. I find I do a lot of self-talk, especially if I'm feeling a little bit down, if my numbers have not been as good as I'd like them to be. I find that the self-talk helps me build that attitude again, and then you move forward. You feel much better about yourself. So it's a case of being good to yourself.
You just take a baby step at a time and deal with what comes up one step at a time. Work through it, and eventually it works. But you just have to work through each step, because it didn't just go straight up. You know, it was a lot of choppy spots in the middle. But you just deal with it and keep going.
I think it's really hard to keep a good grasp on chronic kidney disease on your own. I think with help from friends and family, it's a lot more possible.
One of the most frustrating things for me was when Jen was going through the ups and downs, and she'd get frustrated with what was happening. And the way we got over it was we discussed it and went over the different symptoms so that we could understand and what we had to do next, and then away we went the next day.
It helped a lot, too, that he was positive for me. When I could see that he wasn't fearful, it gave me the support that I needed to keep going.
I believe it's very important that your spouse or someone very close to you should be involved and knowledge about your situation. It really helps when you feel supported, that someone behind you and that you can bounce your worst moments off them and also your good moments. It's really good to be able to share.
You must listen to your healthcare providers. They're trying to provide you with a lot of information. A lot of the time you can't grasp it all at once. Bringing someone along to the meetings can be most helpful. In the absence of that, talking to a family member, a loved one afterwards, can help you put things in perspective.
The advice I would give to spouses of people with CKD would be to learn as much as you possibly can about the disease and be supportive of your spouse in every way you can. I attend all her visits to the doctor, and I read as much as I can about the disease. And I suppose most important, I listen to her wishes and what she needs in the way of support.
Is the fire going?
Yep, it is.
No one needs to be alone in living with kidney disease. Besides family and friends, talking with somebody living with kidney disease can be helpful. The social worker on your kidney care team is highly trained to deal with the emotional and social concerns you may have. Should these services not be available in your community, contact your family doctor, the Kidney Foundation of Canada, or the BC Provincial Renal Agency for more information.
I think the more you know, the more in control you feel. And the more I learn, the more in control I am. I find that it's extremely important. I think a little knowledge is a dangerous thing, so it's a good idea to learn as much as you possibly can. And then you feel at ease. You know more about what can be done for you, what you can do for yourself, and what is going to take place or is taking place.
A good source of information is the Living with Kidney Disease Manual, available from the Kidney Foundation of Canada. There's also a lot of information on the web. In your search engine, type the phrase chronic kidney disease, or go to the BC Provincial Renal Agency website at www.bcrenalagency.ca. Managing your health or self-management is about you taking charge, getting into the driver's seat in terms of managing your kidney health. Using the many resources and support available, you can reduce the impact of kidney disease on your quality of life, and you may be able to prevent or avoid the complications of kidney disease.
Well, I found that the changes started to show, I'd say, probably after about a year. I really got seriously working on my food after about a year and a half, but I had started doing some exercise previous to that. I found that I felt a lot better, that I had more energy, and certainly everybody could see it in me. My voice changed, my hearing got better. There were just a lot of changes that took place because of all that I was doing, and it's made a major difference in my experience.
Accepting the diagnosis of kidney disease is difficult. It's a scary thing to accept. I know I had difficulty with that. But as time went on and I began maintaining myself with the help of all these wonderful people, I discovered that kidney disease is something you can live with quite well.
Well, life does go on, and once you get into a situation where it's routine for you to manage your disease, which does happen really after, I'd say, about 6 months, you find that you do all the things that you've always done and it doesn't interfere at all. For example, I paint and I love to go up in my studio and get lost in my paints. Things are pretty much as they were, just with a few adjustments.
There are lots of moments when you get frustrated and you're unhappy with having a chronic disease, but you have to just push through it and focus on what's important to you. If you look after yourself, you can live with it, and you can live quite well.
Kidney disease is chronic. You have it for the rest of your life. But you can continue to live an active and full life. You play the most important role in the management of your condition. Your job, with the support of your healthcare team and your family and friends, is to stay as well as possible and to protect the kidney function you have for as long as possible.